something I'm interested in is the idea of these myths that I keep hearing around children with complex needs and eye care. I mean, what is the situation there? What are these myths that we hear about?
Well, something that families, teachers will often say is, I don't think you'll be able to test his eyes or her eyes. And even though, you know, one of our key messages is no one is too disabled to have a sight test. And a lot of these myths do stem from our own experience of eye tests. So when you have an eye test in an optician's in the high street, typically you'll have to sit down in a room full of expensive equipment and read down a letter chart and choose between two very slightly different lenses to read the very bottom line. So completely understandably, parents and teachers make the assumption that that isn't accessible to the children that they're working with. But actually, no one is too disabled for an eye test, and we have lots of different ways of assessing vision, and critically we have ways of measuring if you need glasses, if you need refractive correction, just by shining a light in your eyes from arm's length. So I think another myth is often that we try glasses and they may or may not work and it's a bit of a guess, but actually it's a physical measurement of your eyes, the need for glasses. So we can tell exactly how long or short-sighted you are from measuring your eye. And that doesn't need to be a choosing. So the choosing that you do when you go to the opticians and you're looking at the letter chart is the very fine tuning at the end of those measurements, which we can manage without. Now, one of the sort of double whammies is that often we're picking up significant need for glasses at a later age, so that then when we do give glasses, the other classic myth is, oh, children with complex needs don't like wearing glasses. It stresses them out and they won't keep them on. And again, there's two big reasons for that. One is that children, very often their glasses prescription is strong and they have been given it a lot later in life, so they've got to get used to a really different image, processing a really different image of the world, which for anybody is very difficult. But if you have got slower processing, slower cognition, then it's going to be even harder. Then the second thing is that a lot of children that we work with complex needs do have sensory needs. They can be very, very sensitive to having something on their face. Perhaps they've got a headrest, so their glasses are constantly banging at the back and getting knocked from side to side by a wheelchair headrest. So they maybe can't communicate that glasses are uncomfortable in any way other than chucking them off. So there's a common myth around the fact that children won't get used to glasses, and it can be, it's definitely, and that's why it's been so brilliant working in schools, because once we show a teacher or a member of the school staff, this is how this child is seeing without glasses, and we can demonstrate how blurry their world is, and this is what the glasses can do, that can be the real game changer in terms of working together to get strategies in place for them to get used to wearing their glasses. Sometimes little bits at a time over a period of weeks or months, but eventually you'll see a massive improvement in a child's engagement with things because they can see.